compared to yesterday. And this Friday, the metropolitan region posted 113 cases and marking the first triple-digit figure in around 3 weeks. And with that, let's take a look at the map now. We have 74 cases in the capital, Seoul alone, also 47 in Gyeonggi-do province and 23 in Gangwon-do province as well. And this is due to many sporadic cluster infections related to informal gatherings, medical facilities, as well as a military facility here in the capital, Seoul. And this is why authorities are now mulling over whether to raise the social distancing measures to 1.5, which are currently in effect in 4 cities as preventative measures. And in the span between last Friday and this Friday, we do see that except for one day, we have triple digits throughout the week. And also the average of domestic transmissions in the past week stood at 109, so above 100, which is a reason for concern. And this is also largely due to many chain transmissions happening. And government officials also mentioned today that beginning today, people are required to wear face masks and also can be fined for not wearing masks in certain venues beginning today, which let's hope will reduce chain transmissions. Now, with that, the country has a total of 28,133 total infections, and the death toll stands at 488 with 1 fatality reported in the past day. We also have around 50 people who are currently in critical or severe condition.
I see. Before we turn to the international front, so tell us a bit about the government response here to the latest events on the vaccine front.
Right, Sunny, there were some encouraging news of trial results from Pfizer's COVID-19 vaccine earlier in the month, and health authorities here in Korea have expressed their optimism towards such development. And on Thursday, Kwon Jun-ok, the Deputy Director General of the Central Disease Control Headquarters, had the government's official stance regarding the procurement of COVID-19 vaccines. So let's take a listen.
Even if it means we could lose our deposit in the worst-case scenario, we're aiming to secure enough vaccines for 60% of the nation's population by the end of this year, and progress on that front is going smoothly.
Some officials, meanwhile, say even if the majority of the population does get a COVID-19 shot, which may happen next year, basic preventative measures like the wearing of face masks must remain for the time being. And that's something that still many countries are not following, the wearing of face masks. And with that, let's turn to the international figures now. We have a total of 53 million cases around the world, and over 653,000 cases were added in the span of 24 hours. And also almost 10,000 fatalities are happening each day. Let's take a closer look at the major outbreaks. We do see how many European countries are getting up on this table. We see that Germany has surpassed South Africa in just a day, and also the UK has surpassed the total amount of cases of Argentina in the past 24 hours. And also the same goes for Belgium, which has has more cases than Iraq now. So you see how many European countries are still dealing with the second pandemics, the second wave that is, and that's also what our Kim Sung-yeon is going to talk about later in just a bit. Before that, let's take a look at some of the highest rises in the past day. We have the U.S. with over 165,000 infections and the total at 10.8 million, also 33,000 and 37,000, almost 38,000 respectively in the UK and Italy. And those are the figures I have for now. I'll be back with more updates next week. Have a safe weekend. Back to you, Sunny.
Right, so thank you for that. I'll see you again on Monday. Right, now for a closer look at the resurgence in Europe, which has led to a fresh set of restrictions, I have our Kim Sung-yeon here in the studio with me. Welcome, Sung-yeon.
Good afternoon, Sunny.
Right, concerns are mounting over the events over in Europe, as our Kwon-soa mentioned.
Right, Sunny, it's certainly an alarming situation over there. As a resurgent tide of coronavirus infections and deaths, they have been lashing the entire continent. We did hear about the frightening numbers from Seoul just a little bit ago. If I explain in more detail about some of the things that are happening in the key countries across the European continent. Now, if we start with the United Kingdom, according to latest figures, the UK has become the first European country to record more than 50,000 deaths from COVID-19. This comes even after a full national lockdown imposed on November 5th in an effort to curb the spread. A study released last Wednesday also showed that as many as 100,000 people are contracting the disease daily in the UK. The country now sits fifth on the list of countries with the most deaths. Prime Minister Boris Johnson said that every death was, quote unquote, a tragedy and that the nation was mourning the loss of every life. In addition, he warned that the UK was not out of the woods yet. Let's take a listen to what he had to say.
But I've got to stress that we're not out of the woods yet. It does still require everybody to follow the guidance, do the right thing to suppress the disease in the way that we all understand.
Now, the new lockdown in the UK was announced by Prime Minister Johnson last week and will last until at least early December.
Right, Song-yeon. Now, Italy in the early months of the pandemic was an epicenter, and it appears that the situation there is escalating.
Right, things are not looking any brighter in Italy as well, with the country recording more than 1 million total cases just as of Wednesday this week. That's joining the likes of France, Spain and the UK. Now, Italy's death toll is also climbing rapidly amid the second wave, wreaking havoc on the country's healthcare system. In fact, reports are saying Italy's hospitals are near a breaking point due to the sheer number of COVID-19 patients. Now, doctors said this week there would be an additional 10,000 deaths in a month unless drastic action was taken. However, at this point, Italian Prime Minister Giuseppe Conte said his government's goal is to avert a total lockdown like the one Italy endured during the first wave. In an interview with Italian daily newspaper La Stampa on Wednesday, Conte said he was working, quote unquote, to avoid the closure of the entire national territory, adding that he expects the infection curve to start flattening over the next few days, in part due to the effect of the new measures.
Meanwhile, France now is home to the worst outbreak in Europe, having surpassed Russia here.
Right, Sunny, France reported nearly 36,000 new coronavirus cases on Wednesday, taking its total to 1.86 million infections since the very start of this health crisis, overtaking Russia, as you mentioned. Now, this also means France is now the fourth worst affected country in the world, according to a Reuters tally. In fact, the country alone represents nearly 14% of all of the COVID cases in the European region. I also want to highlight reports that say France's second wave has impacted the entire country, with the number of infections exceeding even the most pessimistic projections that have been made. What's alarming is that the country's intensive care units are nearing saturation with 94.7%, so nearly a whopping 95% of all ICU beds in the country now treating COVID patients, according to French government data. In light of the crisis, the country has entered a second national lockdown there, which will last until December 1st, but some medical experts here again saying that the lockdown needs to be a lot stricter in France as well.
And neighboring Germany is witnessing a grim reality as well, Song-yeon?
Right, Sunny. On Wednesday, Germany reported its highest one-day death toll from COVID-19 since April, according to Reuters. That is, Germany's health minister has also mentioned that Germany's aging population, as well as diseases such as diabetes, makes COVID-19 particularly dangerous to many. Now, back in the early part of the year, back in spring, Germany was seen as a role model for its fast and aggressive testing and contact tracing, which was credited with keeping the country's death toll low. However, rising cases have pushed the government to announce a partial lockdown from November 2nd. German Chancellor Angela Merkel stressed that the second wave will be tougher indeed. She spoke of this at a meeting with the German government's economic advisors in Berlin on Wednesday. Take a listen.
We have to assume that the second wave will be harder, and it mainly falls at a bad time of the year. It'll keep us busy all winter.
She added that the crisis can only be overcome by working together, highlighting that even the positive news about the latest vaccine development would not change the current situation or help us immediately in the coming winter. Therefore, she urged people in Germany to stick to preventive measures currently in place for the month of November to avoid a national health emergency. Now, global experts are sounding off warnings that the pandemic is likely to worsen before it gets any better, despite hopes over the new vaccine because of the cold temperatures that lie in the months ahead of us.
I see. All right, Song-yeon, thank you for that coverage. Hope to see you again soon.
Thank you. The pleasure is mine.
Right, starting today, actual fines will be levied on those who violate mask mandates to ensure that all play an active role in ensuring protection against the pandemic. I have our Chun Song-cho out and about here in Seoul to show us this mandate and its penalty in action. Hello, Song-cho.
Good afternoon, Sunny.
So, Song-cho, where exactly are you?
Well, I'm at Susa Station in southeastern Seoul, and yes, today is the first day since the mandatory mask-wearing law went into effect. And what better place is there than a train station to check up on people, how well people are abiding by the law in general? Well, this Susa Station is a perfect place to do that because it not only connects subway stations, subway rail lines, but also SRT trains, which are high-speed rail lines that run all the way from Susa to the southern cities of Mokpo and Busan. On average, 35,000 people visit this station on a daily basis. That's a lot of people. So it may not be the most ideal, desirable place to be in the middle of a pandemic, but I think that's why it's even more remarkable to know the fact that, well, there have been no COVID-19 cases reported or people who got infected from contracting the virus while using the Susa subway station building or on the train. That's remarkable, right? Well, that is all thanks to a stringent safety measures that are in place in the subway station. So for more on that, let's talk to some of the officials from the station who can tell us more about the efforts that they're putting in. So here is Mr. Cha. Good afternoon.
Good afternoon.
Yes. So can you tell our viewers how the station is making sure that no virus gets passed around inside the facility?
Since January, when COVID-19 was first broke out, we have been conducting special disinfection measures at least 4 times in train, 3 times at the station daily. To prevent air infection, we have been ventilating cars by using our air conditioning system and also have installed mask vending machine in all train. Furthermore, we are planning to introduce our high-tech antivirus robots at the end of this year and continue our stringent virus containment efforts.
Oh, wow, that's a long list of measures. Thank you for your answer this afternoon. Thank you. All right, so without further ado, let's check inside the car how people are doing, actually. So, all right, so I see a number of people already sitting in their seats. And, oh, wow, the first thing I notice is that everyone is wearing face masks. There's no question about it. Every single person is wearing face masks. Well, actually, starting today, anyone who is found not wearing a protective mask on their face in public locations or on public transportations can be fined up to 100,000 Korean won, which is equivalent to around $90 US. And even if you're wearing one, you can still be subject to fine if you're not wearing the mask properly. So remember, you have to make sure the mask covers entirely your nose, your mouth, and your chin. Just make sure that it covers all the way down to your chin. But what if your mask gets ruined while you're on the train? Can that be an excuse for not wearing one? I don't think so, because there are things like this vending machine right here where you can easily get your hands on a new face mask. See number 3 right there? So that's a disposable face mask that you can get just with 2,000 won, which is like $2. That's pretty cheap. All right, so this train is about to depart in around 10 minutes, so I'm going to get off the train. All right, so I think people are really going to appreciate all these measures because this is what allows them to really trust the system and really feel comfortable while getting on the train. Wearing a face mask is no longer an option. It's a must. Well, there are even experts who are saying that face masks are even more effective than a vaccine to prevent COVID-19. So this is the most powerful, most important public health tool that we have. So let's embrace it and not take it for granted. This has been Jeon Sung-cho reporting live from Susa Station, and back to you, Sunny, in the studio.
All right, Sung-cho, thank you for those words of wisdom and thank you for that coverage.
We know the single most effective thing we can do to stop the spread of COVID is wear a mask.
다가오는 금요일부터는 마스크 착용 의무화 위반 시 과태료가 부과됩니다. 과태료 때문이 아니라 본인과 가족, 이웃의 건강을 위해 마스크 쓰기를 생활화해 주시기 바랍니다.
Korea's revised social distancing guidelines place much importance on the wearing of face masks within public venues, and starting today, violators are poised to face actual fines. Now, for more on this potential role of this mandate in easing the spread of the virus, I have visiting Professor An Jun-sung from Yonsei University. Good to see you again, Professor An.
Thank you very much.
I also have Professor Chung Son-jae from Yonsei University as well. Pleasure to have you back, Professor Chung.
Thank you for having me again.
And joining our talk virtually from the US is Dr. Monica Gandhi from the University of California, San Francisco. Welcome, Professor Gandhi.
Thank you.
Professor An, we'll start with you. Following a grace period of exactly a month, starting today, those who refuse to wear face masks will be faced with actual fines. What are your thoughts on day one of this tougher mask measure?
Well, I think that the general public in Korea is well aware of two facts. First one is that today is the first day of the mandatory mask wearing policy, and the second is that if you fail to wear it properly as required by the law, you will be subject to the fine of 100,000 won. So it's quite. I think that most people understand. And I had a lunch with my friend. Actually, we talk about the issue, how to wear it, proper wearing. So I guess I think there's very clear. Understanding about what's going on. I think that's a good sign, but still, there are some people I said still might be resistant, to the government policy. So that might be the issue, how to enforce it.
Right, and we'll talk about that in a little while. Professor Chung, as Professor An just mentioned, the mandate calls for proper types of face masks as well as the proper wearing of face masks. And what does this mean? And do tell us a bit about some people who are exempt from the regulation altogether.
Yes. So to start with, maybe we can start with how to wear the mask properly. Maybe Dr. An knows very well because he has been taught with the friends about this. One thing I want to mention is that the principle is to cover your nose and mouth completely with the mask. So please use the wire on the top of the mask to fit your nose, and also please wear your mask down to the chin and check out if the mask inflates accordingly as you breathe. And as much as possible, please check if you are wearing a mask marked as quasi-drugs, or we say 의약외품, because it's preferred to use masks such as KF94, KF80, or KF80. And also when wearing a mask, the outer part of the mask should not be touched because they can be contaminated by the virus. And also when you're removing the mask, please use the ear strap on the mask. And as Sunny, you said, it is important for everyone to get the mask. However, there are people with exemption, and these include the children and adolescents aged under 14, and also people who were confirmed by doctors that they will have the difficulties in breathing while wearing a mask. So I think the people with developmental disabilities or who cannot get their own mask on or off, they should be exemption from this regulation.
I see. Professor An, I believe legal revisions were made to allow for a tougher penalty with regard to violations of mask mandates. What are your thoughts on such efforts on the legal front to better control the pandemic?
Well, I guess, as you know, that some European countries already did, doing the same policy about, imposing the fine with a fail to wear the mask. So it's not it's a unique situation here, but it's more like sending a clear message to the public that, it's government mandatory and it's very important for, general public health issue. So I think that's clear understanding. But however, that in terms of enforcement issue, that there's always some people, who will kind of, disagree with the government policy and try to do, say freedom of choice, basically. So I think that's what happening in EU as well. And I think that's the one, you have to deal with situation case by case. But still, it's very, I think, important the government send a clear message to the public and by law, right? And then, instruct them how to do it and provide some, clear guideline what to do, what not to do. But my concern is that a little bit the current version of the policy is that there's so many exceptions also, and it's not quite easy to understand what is a proper mask wearing. Actually, depends on the type, what type of mask. It's a KF 80 or 90 something. Maybe it's not really quite easy for the common people to understand how to do it. So that might be the things your government have to pay attention to when in dealing with the situation.
I see. Meanwhile, Dr. Gandhi, I understand you took part in research that shows face masks not only reduce chances of infection, but also the severity of symptoms in the case of an infection. Can you tell us a bit more about your research?
Yes, so you're right that facial masks will reduce the risk of transmission. So that's in and of itself a good thing. But essentially the work that we've been looking at along with some others is this question of facial masks, if you do get infected, reducing the severity of disease. And there are sort of three lines of evidence that we've been looking at in relationship to this severity of disease. One is virologic, one is epidemiologic, and one is ecologic. And what I mean by virologic is that in animal studies, the more virus that you give animals with many viruses, the more sick they get. And even in the hamster model with this virus, the more SARS-CoV-2 or the virus that causes COVID, the more likely they are to get sick. So that's sort of the virologic evidence. Then epidemiologically, we have been seeing in settings that mask that people have had much reduced symptoms where they mask if they do get an outbreak versus places where there's no masking going on. The amount of infection and asymptomatic disease that you get, asymptomatic, no symptoms, has been going up with time in settings where there are outbreaks where people mask.
I see. So essentially, Dr. Gandhi, great exposure to heavier viral loads results in severe symptoms, you're saying?
Yes, I mean, this has been true of other viruses as well in humans. So there have been many challenge experiments, for example, not with this virus, because it would be very dangerous to give humans a little bit of virus, a lot of virus, and see if they get a little sick or more sick. That would be, not feasible, not ethical in humans. Right. But with some other viruses, where they have done challenge experiments, where you give human volunteers a little bit of virus and then more of a virus, people get more sick with that higher viral dose. We call it viral dose or viral inoculum. Examples of that would be influenza, that people have looked at influenza and giving challenge doses, something called respiratory syncytial virus, which is RSV, rhinovirus, even rotavirus, which causes diarrhea. The more you give, the more sick people get. So these kind of challenge experiments in other viruses gave us the clue that this could be happening with SARS-CoV-2, the virus that causes COVID. And even at the beginning of this infection, people were very sick. And we have been seeing the mortality rate of this infection, luckily, decrease over time. And we don't think it's just better treatments, though those are there, because we know about steroids decreasing mortality, and we have an antiviral. But it seems that even the percentage of people that get hospitalized per case and this is research we're doing here in this country, so hospitalizations per case have been going down. So if you have more cases and yet they're more mild, then it could be because we are keeping away from each other, we're wearing our masks, and because of that, we're having reduced viral inoculum or dose.
Right. Professor Chung, I believe you have a question for Dr. Gandhi.
Yes, thank you for your wonderful information. I just want to ask one thing. So could you tell us more about the implication of your result, maybe about virulence or epidemiological evidence or like the others in comparison with other real-world data which regard with the actual COVID-19 cases such as Oregon seafood plant or diamond princesses or so. Could you give us some more implication about your research?
Yes, that's a great point. So essentially, we were looking at case studies or places where there were outbreaks. And a good example is the cruise ships. So at the beginning of the pandemic, certainly the Diamond Princess cruise ship got a lot of attention because it was the first cruise ship. It went many places, and there was a major outbreak on board. It went to Japan. It was here in San Francisco. And in the case of the Diamond Princess cruise ship, between 20 and one analysis showed 40% of people were asymptomatic, no symptoms with COVID-19. And in fact, the CDC, based on that data and data from other studies, have estimated the rate of asymptomatic infection, having no symptoms from COVID-19, at 40%. And that's the bizarre part about this virus, is that some of people are completely fine and some people can become very ill. So then when we looked at another cruise ship outbreak, this was in Argentina, where there was an outbreak on board. This time they also didn't let the passengers off, but they gave them all masks. They gave the staff N95 masks, they gave the passengers surgical masks, and the rate of asymptomatic infection was 80%, so twice as high. And then another example, like you said, is the meat processing plants in the United States, that at the beginning of the pandemic, we had a lot of meat processing plant workers becoming quite ill. And there was a large outbreak in a Tyson chicken plant later in the pandemic in Arkansas, and also a seafood processing plant in Oregon, where everyone was masked. They gave them masks, they mandated mask wearing, and the rate of asymptomatic infection was 95% in over 500 people that got infected. So it does seem that this rate of asymptomatic infection is going up with time. And then finally, in healthcare workers, we were quite sick at the beginning, and with time, healthcare workers, with the universal masking, have been more asymptomatic infections.
Right. Professor Chung, keeping in mind what Dr. Gandhi has just said, could we take this moment to touch upon the efficacy of the face masks at our disposal here in Korea, which would include, like you said, the KF94, the KF80, as well as the KF-AD?
So yes, actually for now we don't have the actual population data. However, when we are seeing the information from actual filter rate, like when we say that KF99, it means that it filters 99% of the microdust, which has a size of like 0.4 micrometer to like 0.6 micrometer. And actually these masks were developed because of the microdust. However, now we are using in the COVID-19 situation. And when we are considering that the size of the COVID-19 virus particle would be like 0.1 micrometer. However, it is always moving with the droplet, which has a size of 1 to 10 micrometer. So in that case, maybe like KF99, 94, or 80, they have been proven that they are filtering this kind of particle more than 90%. So it can be like a mechanical evidence for that. And along with that mechanical evidences, I want to mention like the study from the Professor Gandhi. It has suggested that this wearing face mask can work as also the vaccination, because it can make you to exposure to the lower dose of COVID-19 virus. So it'll make kind of sort of work as a vaccine. And also it cuts down the chance of both transmitting and also catching the coronavirus. And also if we know from the study that there was a 25% of the animals who have been protected from the mask outside the coronavirus. But however, when they were infected also, they got the less severe symptoms of COVID virus as usual as the human cases.
I see. And keeping that in mind, Dr. Gandhi, despite that reality and findings by your study, the issue of wearing masks remains a controversial one over in the US. Now, do you suppose your efforts could perhaps raise greater awareness about the potential role of facial protection in the fight against the pandemic over in the US?
I hope so. This is why I've been working on it so much, because I do think that what happened in the US is that when the CDC put out their recommendations on April 3rd, they said masks protect others. Wear a mask to protect others. We are, up till recently, we were not in a good phase in our country in terms of civic duty, people looking out for each other. It was a difficult administration. And because of that, we were really trying to push this message through our research and other people's research. Masks protect you as well. And I think a huge victory that happened was just 2 days ago, actually on Monday, the CDC changed their messaging. And now it says, wear a mask, it protects you and it protects others. And I am hoping that that kind of change messaging will convince the naysayers who are saying masks don't work. President Trump didn't wear a mask. He didn't tell me to wear a mask, and all of the kind of complicated reasons that we've had such fights about wearing masks. I don't think there's any other country that have fought it as hard as the United States has.
Right. So which is why, Professor An, as mentioned by Dr. Gandhi, there still appears to be much opposition to the wearing of masks in quite a number of countries in the West, not just in the US. How do you explain this aversion?
Yeah, I think that in the Western culture, there's a negative perception about the covering up their faces. For example, Western men tend to think that the wearing a mask is a sign of weakness, therefore it's not masculine. It's kind of ideas, right? Also, it could be a negative impression is that you covering a face means that you try to hide something or with bad intentions. It's like a bank robber. But however, if you see that in the Korean side, it's the other way, a reverse effect, actually. The people see it, wearing a mask is a part of culture in daily life, and then, in a very easy access to buy it. You can have, even summertime, you could buy any place. But if you go to US, even the winter time, it's very hard to find any mask to buy because they don't have mask. So I think that's the things that how the people approach it. I think the EU, when the anti-mask demonstration happening there, I think that people see that the mask as a sign, a symbol of their gag to their freedom of speech. Basically, they try to speak against the government policy, and they try to prevent us to say whatever we're going to say. So about the First Amendment right, freedom of speech, and also the freedom of association. So I guess that's how things see it. But I'm really wondering how. I'm really concerned about the situation in the EU and the things that they see as too much politics about which side you are, rather than is it really science or not. I think that's the really concerning fact. But I think that's the concern. Also, same thing in the US actually.
Right. So the issue of wearing face masks might have been politicized. Dr. Gandhi, I believe you have a question for Professor An.
Yes, Professor An, in relationship to what you were just talking about, I wanted to know about the mask compliance rate in your country even before, because the fact that you imposed mask mandates and that you've been talking about, I listened to the story about the fines, means that what was the compliance rate before these harsher rules were put into play? And how do you use public health messaging in South Korea to encourage the populace to mask? What messages do you use?
Okay, right. Okay, there's two questions. I guess for the first
questions,
question, yeah. First question is that about the rate of the mask wearing. I believe that when I got my information I got it, I think it's about 90%, I think, right? It's about 90%, it's over 90%?
I think it's over 90.
Yeah, over 90%, yeah. I think that's the things, the most recent data I read it from the newspapers, so it's pretty high. And also, right, I think one of the things is the difference in US and Korea is that about the consistency of message. Because from the corona outbreak in last March, Korean government is very consistent on the mask wearing policy. They say should wear mask wash your hand, keep the distance, and wash, that should wear the mask. But however, I remember watching CNN news, and maybe last summer, what they do is that they always talk about social distancing and washing hands. How to washing your hand, how to use soap. But I haven't seen any CNN news or other US news or media talking about how to wear a mask. But if you watch the Korean news, you can see very often everybody wear a mask and they even explain how to do it. I think that's things one. And other things, my speculation is that I wonder how the medical community in US to deal with the situation about the mask wearing situation, because my personal impression about the US medical community is that they kind of have a deeply mistrust on the mask, effectiveness of mask. Because I think you talk about the breathing in, breathe out situation. Because my impression was that when you say breathing in, you like protect yourself, and breathe out, protect others, right? The way I remember that one of my friends told me a long time ago in medical school, and they told me that they believe that wearing a mask can will not protect you get infected, but will prevent you, breathing out something bad to others, right? So I think that's the things how even perhaps there's a very strong misbelief or any deeply believe that about the kind of anti-mask, idea position. I think that might be a factor as well.
Right.
So.
No, I think you're very right that the fact that the CDC only said 3 days ago that masks protect you and others, 3 days ago, 11 months into the pandemic, speaks to this question that we were messaging improperly, I think. We were.
Dr. Gandhi, you also have a question, I hear, for our Professor Chung.
Yes. Well, I guess my question for you, and this was partially, we partially actually talked about this in a way, but where are the situations that masks are recommended? And what I mean by that is there is a big argument also going on here about outside, if you're just passing someone, if you're exercising, versus inside, where people seem to believe more that a mask wearing should happen. So my question to you is, in South Korea, is it recommended that people are always, even outside, wearing when they're running or jogging? Is there exceptions beyond the ones that you mentioned earlier today?
Yes, so actually, quite recently, there was a novel 5-stage social distancing was adjusted in Korea. Well, there was a previously 3-stage. Now we are getting this wearing mask mandatory criteria for this new 5-stage social distancing. And actually, how to wear the mask and also the range they have to wear the mask differ by stage and step by step. So in the first stage, when we say it's a usual life protection, it became mandatory to wear masks in public transportation, medical institutions, and gatherings, and indoor sports, and high-risk workplaces and entertainments. And in the stage 1.5 to 2, which we call community epidemic, the outdoor sports facilities and entire indoor area are getting into the criteria. And actually, in the addition, the stage 2.5 to stage 3, referring that the national epidemic stage, which means like more than 400 daily new cases occur nationally, then we must wear the mask anywhere outside also when you cannot keep your distance at least 2 meters by each person.
I see. So if I'm exercising at the Han River, that is, Dr. Professor.
Well, actually, in that case, as epidemiologist, I think it's okay. Because
we're outdoors.
Yeah, because we're outdoors. But when you get the new stage as the 3, like the extreme stage, then if you're running the Han River, but if you cannot guarantee you having the 2 meters or more, then you have to wear it.
I see. So the extent of mask wearing will actually depend on the level of social distancing here in the country. I see. And just out of curiosity, Professor Chung, how often can we reuse our face masks? My question is, do you wear a new mask every day?
Yeah, actually, no. Because right now, when I was in the MERS outbreak, it was 2015, and that at that time, the principle was to throw away the mask once it was worn. However, now everybody should wear a mask, and now we are facing the environmental disruption and the waste. So I think if you are on the usual condition and just not going to crowded places, I think you can reuse. However, it should not exceed 2 to 3 days. But in the situation like you getting wet mask or you're going to the crowded places, then please consider to replace your mask as soon as possible.
I see. Right, Professor Anna, here there is something that you would like to ask Dr. Gandhi today.
Yeah, my question is that President-elect Joe Biden is advocating a federal mask mandate to cover all 50 U.S. states as part of his pledge to tackle COVID-19 pandemic. So what has been the public reaction in U.S. to Biden's tough stance on the mask wearing?
Yes, it's a great question. And number one, I was very delighted when he said that, because I think that we have had a disorganized federal response, and things that happen at a federal level can then lead the populace to believe it, as opposed to one city says do this and one county does that. But that's part of this problem and the structure of our government. So I was very excited when he said that. However, we have a very divided country at present. The election was just a week and a half ago, and 70 million people voted not for Biden. And that division in this country, which I hope President-elect Biden can heal, means that many people are saying, I knew he was going to say that, I knew he was going to do this, and that's a restriction on my personal freedom. And so that's part of the ethos of this country that has caused us so much trouble. And one thing I want to say to people here is that your personal freedom is already restricted by the COVID-19 pandemic. You can't go to a movie, there's so many things are closed. And so the faster we can get through this, the better. And if we had masked more adherently, I don't think we would be where we are right now, which is that we've been the epicenter of this pandemic. I always praise South Korea and Hong Kong and Taiwan and Japan and Vietnam and Thailand. I always think about the East Asian countries when I think about what has been done right and what's been done wrong, and that's our country.
Right. Meanwhile, hopefully that will change, Dr. Gandhi. Here in Korea, meanwhile, Professor, and the process of enforcing mask mandates is expected to come across some challenges. Now, despite our more than 90% mask compliance, we've heard of violent confrontations between the very few who refuse to wear their masks and those who urge them to do so. What can be done to address these challenges?
Well, as we discussed earlier today, I mean, there's always new policy. There's always people, disagree. Because it's a democratic country, you can say no, whatever you want to say, right? It depends on your position, right? So I guess that the government policy is that you try to set clear goal, what to do, and provide clear, the specific details how to do it, and then that's let the people decide what they want to do, I think, and then person with the reasonable, decision, right? Reasonable person will do it for the protection for himself and the neighbors, the people surrounding you.
Right. Professor Chung, what can be done to encourage greater public engagement in the mask mandate?
Well, actually, like Professor An said, I think also the messaging from the government and messaging from the community is very important. Like the mask protects you from COVID-19 and also protect others from COVID-19. And the one thing I want to mention is that we have to understand about people who have difficulties wearing masks. And in that case, the government or the other authorities should give them the alternatives. Like if you have wearing too high-level filtered masks, then please use other lower-level filtered masks such as KF80 or KF80 for their breathing problems also. And the last thing I want to mention is that mask is not only the important thing, but also washing hands and do the social distancing is really important in our quarantine. So I think overall this balance in the quarantine measures should be underlined.
I see. Meanwhile, Dr. Gandhi, do you believe that perhaps building or perhaps ensuring greater public awareness about the results of studies like yours would encourage people over in the US to perhaps adorn masks then?
Yes, I have had like 3 people at least say, okay, I didn't believe it before, but now I believe it. even 3 made me feel very happy that they said that. But yes, I do think this kind of research, the research that it protects you, the research that if you get an infection, that you could get a mild or asymptomatic infection and not be in risk of the scary, severe disease. That's frightened us all. I think that's encouraging and it's positive. And I think that we need optimistic messaging right now because COVID-19 has destroyed 2020. It's made it a very difficult year. And so I hope that this is a sense of you have control over your own health, even during a pandemic, by wearing a mask.
Right. Thank you for those words. All right, Dr. Gandhi, thank you for being with us today. Professor An, thank you for your time.
Having me.
And Professor Chong, thank you for being with us today. Right, well, that ends our coverage for this week. Now, do remember to abide by the mask mandates as violators face actual fines starting today. Thank you for watching. Have a safe weekend. See you on Monday.
As COVID-19 persists, the Korean government is revising the three-level social distancing rule into 5 stages. The updated guideline aims to prepare the country for the outbreaks in the long run, as well as to ease the economic burden for small business owners.
관리 가능한 수준에서의 안정적인 억제를 중시하면서 보다 지속 가능한 체계를 목표로 사회적 거리두기를 재편하고자 합니다. 먼저 기존의 3단계 체계를 보다 세분화하고 권역별 대응을 강화할 것입니다.
After the revision, levels 1.5 and 2.5 will be added to the previous 3-level system. For level 1, citizens are encouraged to carry on with their everyday life while strictly following the prevention measures such as wearing masks and washing hands. Level 1.5 and 2 take effect with the occurrence of isolated regional outbreaks. People need to start avoiding unnecessary gatherings and public facilities. Level 2.5 means there is a sign of a general nationwide outbreak. At this point, citizens are strongly advised to stay at home as much as possible. The last stage, level 3, takes effect when there is a widespread outbreak all over the country. Most people need to stay home and avoid contact with others. Coffee shops and restaurants may remain open, but indoor dining may be restricted. The new 5-level social distancing rule goes into effect starting from November 7th. Even though the new guideline eases some regulations on businesses, mask wearing and personal hygiene practices will be strictly enforced in order to contain the disease. Overcoming COVID-19 together, let's stick to the basics.
아나운서와 함께 배우는 한국 문화
K컬처 인플루언서.
안녕하세요. K컬처 지킴이 현장 김효진입니다. 끼우.
안녕하세요. K컬처 꿈나무 장현입니다. 깍.
끼우는 뭐예요?
뭘 좀 하고 싶어서 그래요.
그렇죠. 네, 오늘은 K-뷰티 클래스의 날이에요.
아, 그래요?
날인 만큼 정말 대단한 분을 한번 모셔봤습니다.
오.
K-뷰티계의 미다스의 손으로 유명하십니다. 신님 모셔보도록 하겠습니다.
안녕하세요.
네, 신님은 스타 커버 메이크업은 물론이고 원브랜드 메이크업 등 정말 많은 뷰튜버 분들이 따라하는 컨텐츠를 만든 정말 1세대예요. 전 세계에서 K-뷰티를 정말 주목하고 유명하고 따라하고 있잖아요.
네.
그 비결이 뭐라고 생각하세요?
아무래도 K-뷰티가 먼저라기보다는 이제 한국 드라마, 영화, 아이돌 친구들이 한류 문화를 굉장히 널리 이제 전파를 하고 있기 때문에 그들의 메이크업 혹은 뭐 피부 표현, 아이 메이크업 다 유행하게 되는 것 같아요.
자, 그럼 본격적으로 K-뷰티 메이크업을 배워볼 텐데요. 자, 세종학당에서 함께 해주셨습니다. 와!
안녕하세요. 그럼 이제 메이크업 시작할까요? 저 이렇게 생얼로 방송에 나온 적 처음이거든요.
어머,
오늘
거짓말.
여러분들을 위해서.
어머.
진짜예요?
아, 방송에서.
TV 방송에서 한 번도. 메이크업 베이스에는 두 가지 종류가 있어요. 첫 번째는 수분을 조층하는 메이크업 베이스. 그 다음에 두 번째는 이제 유분을 잡는 베이스. 이렇게 있습니다.
건조해요.
건조해?
네, 엄청 많이.
건조하면은 수분 메이크업 베이스 쪽으로 갈게요. 메이크업 베이스는 한 이 정도? 약간
콩알 만큼.
이제 얼굴에 전반적으로 발라줄게요. 이제 피부에 어떤 누런 칙칙한 톤을 좀 개선을 시켜주고 수분도 한 번 더 더해주고.
네.
근데 약간 여기 빨간기가 올라왔는데?
너무 세게 때려서 그런 거.
얼마나 세게 때리면 이 빨개지는.
컬러 코렉터라고 베이스보다 조금 더 색소가 진해요. 많이 바르면 안 돼요. 이런 트러블 같은 거를 그냥 톡, 톡, 톡 이렇게 붉은기를 가려줍니다. 저 같은 경우는 파운데이션 이전에 컨실러를 쓰고 있습니다. 그래야 조금 더 고정력이 강한 상태로 오래 지속되기 때문에 컨실러는 중요한 거는 너무 밝은 걸 쓰면 안 돼요. 자기 피부랑 완전히 똑같은 걸 찾아보세요. 다크서클에 한 요 정도 양을 발라줄 거예요. 자, 요렇게 다크서클 위에 발라줍니다. 자, 해줄 때는 역시나 수직으로 발라주는데요. 다크서클과 맨피부의 경계를 없앴기 때문에 다크서클이 없어 보이는 거예요. 잘하고 있어요. 잘하고 있어요.
화장할 때 표정이 너무 귀여우셔.
이렇게 하는 거 맞아요. 원래 이런 표정으로. 자, 이제 퍼프에 남은 양이 있죠. 퍼프에 남은 양으로 우리 코 옆에 있는 이제 그런 실핏줄과 이제 빨간 뿔긋뿔긋한 것들을 덮어줍니다. 피부가 보정되니까 너무 예뻐졌다. 아, 다크서클만 가려도 이쁘네, 엄청.
그러니까.
아까 되게 이렇게 칙칙한 것 같았는데 너무 예쁜데? 네, 그 다음에 이제 파운데이션 바를 거예요. 자, 그럼 자아르부터 제가 디렉션 줄게요. 그거를 이제 발라서 피부에 이제 올려줄 건데요. 너무 많이 찍지 말고 조금씩 얼굴 중심을 위주로 바깥으로 가듯이. 그 다음에 엔젤은 저랑 똑같이 손으로 먼저 찍어서 네, 톡톡톡 톡톡톡 발라주고 나서 이제 두드립니다. 베이스 메이크업, 파운데이션까지 했는데요. 지금 두 분 다 지금 피부톤 바꾼 거 보세요?
너무 예뻐요.
나 진짜 자스민 공주 같아요.
그러니까요. 너무 예뻐.
자, 이제 다음 단계는 우리 파우더를 쓸 거예요. 브러쉬 중에서 가장 플러피하고 제일 큰 거, 여기 브러쉬 있죠? 아, 좋아요. 큰 거. 브러쉬로 파우더를 한 번, 두 번 찍어주고 톡톡. 이제 특히 우리가 잘 번지는 부분, 눈. 우리 크리즈 라인 있잖아요, 눈에. 여기를 이제 톡톡톡 발라줄 겁니다. 그리고 코 옆에까지.
높게 보일 수 있게.
알겠습니다. 코를 조금 더 오똑하게 보일 수 있는.
네.
자, 컨투어링 같은 경우는 자기 피부보다 어둡게 턱 라인 따라서 발라줍니다. 보통 턱을 좀 작아 보이게 하고 싶다면 이만큼 브러쉬가 올라올 거고 턱을 그대로 강조를 하고 싶다면 이렇게 꺾어서 턱 바깥쪽으로 쓰겠죠? 보통 이제 헤어라인이 노출된다면 이제 이렇게 헤어라인 따라서도 한 번씩 발라줄 수가 있죠. 피부톤에서 이제 턱보다 조금 더 밝은 컬러, 중간이나 첫 번째 있는 컬러를 섞어서 사용을 해볼 거예요. 인상을 써요. 이렇게. 그러면 그림자가 생기죠. 이렇게 하면 생기는 그림자 라인이 있어요. 살짝 생기면 그 그림자를 발라주고 블렌딩 해주고 발라주고 블렌딩 해주고 코 중간 부분은 너무 진하지 않게 하고 코 끝을 조금 더 진하게 합니다.
엔젤 점점 코가 생기고 있어요.
그래요?
너무 예뻐.
자하르는 너무 코가 높아서 많이 안 해도 돼요. 자, 그 다음에 우리 이제 하이라이터를 할 거예요. 바로 컨투어링이랑 반대되는 색깔인데요. 그래서 코에다가 발라주는 거죠. 코끝은 손으로 톡톡톡 발라주면은 밀착이 굉장히 잘 되기 때문에 다 똑같은 색깔이면은 분필처럼 보이고 끝에만 조금 더 하이라이트를 강조해주면 이제 좀 더 입체감이 생겨요. 그래서 코를 해주고 이제 이마, T존이라고 하죠. 그다음에 우리 칙본, 여기 광대뼈 부분도 한 번씩 쓸어줍니다.